illness that affects the meninges, which surround the central nervous system. And it is usually from a pathogen, a virus, a bacteria, or more recently, you may be aware of the fungus outbreak. It is a very serious infection. Usually presents with fever and something along the lines of what we call nuchal rigidity, which is it's hard for the person to actually bend their neck because it hurts so much. Generally, they're very ill, even if it's a virus. And it can come with respiratory symptoms. It can come from other sources, such as a bacterial meningitis actually might come from the sinuses or from an ear infection. But they're often due to situations in which there's some overcrowding, which is one of the reasons why college students are recommended to get the meningitis vaccine. As a mother, I would choose to vaccinate because it's a serious illness. It's an illness that also makes you very ill, but also can result in death. And we have a vaccine that helps protect against one of the most common types of bacterial meningitis. It's a safe vaccine, and so for me, the risk-benefit ratio definitely falls squarely in the category of benefits.
The meningitis vaccine for particularly a variety of bacteria, most importantly a bacteria called Neisseria meningitidis, which is the bacteria that, for example, college students are at risk of getting when they move into dormitory-like facilities, is incredibly important because it can protect young, otherwise healthy people from a deadly infection. It's very effective, it's safe, and it's important to administer to anybody who's at risk. Meningitis is a life-threatening infection that anybody is potentially able to get. It's due to a variety of microorganisms, viruses, bacteria, fungi, and even parasites can cause meningitis. And of all the infectious diseases out there, it's one of the most serious and potentially deadly infections. So I'm an infectious disease doctor, and I specialize in dealing with a variety of infections, and so I come across people who have meningitis on a fairly regular basis. They are always very, very sick. And they require a lot of intensive medical care, antibiotics. If they're sick enough, frequently they end up in intensive care units on ventilator machines, and most of them make it, but some of them don't make it, and it's our job to try to prevent the infections from happening in the first place so they don't get that sick.